Julian, it's Michelle Companese and Taylor Mitchell coming at you live with our toolbox assignment to aid us in the survival of our praxis and in the first few months of our future nursing practice. We have chosen 10 artifacts and 5 CNO practice standards and or guidelines.
Undoubtedly so, we'll be feeling a variety of emotions as we enter this phase of nursing. These emotions can and most likely will include anxiety, fear, lack of confidence, but also excitement, a willingness to learn, partnered along with our passion to begin feeling as though we're truly helping other individuals.
All right, so in semester 1, Health and Healing, we learned about the determinants of health and their impact on health, wellness, and promotion. The determinants of health include stress, bodies and illness, income and income distribution, education, unemployment and job security, employment and working conditions, disability, early childhood development, food insecurity, housing, social exclusion, social safety net, health services, Aboriginal status, gender, and race. We collectively discussed how and why the lack of one of the previous stated determinants can cause, affect, or exacerbate an illness. This tool is important for us as new nursing graduates because it is the foundation of every patient's social, mental, physical, emotional, or potentially spiritual history. This is crucial when we are going to be providing holistic nursing care.
During semesters 1 and 2, we attended our hybrid courses, Fundamental Healing Arts, followed by Advanced Healing Arts. The courses required us to complete lab preps each week that included questions and outlines of our nursing skills. At Praxis, at our new job, we can turn to this tool if we are ever feeling doubtful or forget the correct procedure for clarification. This tool allows us to gain a deeper understanding of our scope of practice within the profession and is a portable booklet that we can bring with us to Praxis or a new job. Other resources such as the RHPA Scope of Practice Controlled Acts constructed by the CNO will allow for further knowledge of our scope of practice as we go into nursing.
So item number 3, which is included in the lab preps for Fundamental Healing Arts, was the infection prevention and control concept. Encompassed in this concept was the skill of donning and doffing PPE, and although this seems like a minor task, when in the hospital it can be difficult to recall and maintain proper precautions. We are aware that infection prevention and control are crucial elements to protecting the nurse and the patient, as well as it helps to minimize the spread of any potential infections. So as part of the infection prevention and control, our lab kit actually came with 2 of these little
Name tag type things?
Yeah, name tag card type things. And it actually has like the donning and doffing of PPE on one, and then the additional precautions on the other. So it could be droplet and contact, or airborne, and like what to do, what to wear, what not to wear in each of these situations. So you can you can attach this to your name tag, and it can help you so you'll never forget.
Our next item is going back to the resource we mentioned on item 2, the RHPA Scope of Practice Controlled Acts model outlines the scope of our practice statement, controlled acts, and who is authorized to perform the controlled acts in nursing. This guideline includes various important information that we will utilize throughout our careers. As novice nurses, we may not be as familiarized with this practice guideline as an expert nurse would be. So due to that fact, we have not been accountable to our own nursing license thus far. So this is very important that we utilize this to ensure our competency and safety with our patients. We have highlighted some specifically important information throughout the document to provide effectiveness and clarity for nurses who wish to utilize this as a resource. So it just makes it a little faster to find the important things.
Right. Our second CNO document is the Entry to Practice Competencies. This document contains a framework that supports autonomous decision-making in one's practice. This is a crucial element to our nursing as it outlines all of the competencies mandatory for nursing care. We've highlighted the important attributes of this document. It's just scattered throughout.
And then the one we highlighted quite a bit was this framework. The Therapeutic Nurse-Client Relationship Practice Standard is a CNO document that outlines the 5 components of key relationships within the nursing profession. These components are known as trust, respect, professional intimacy, empathy, and power. As nurses, we need to be aware of our actions as healthcare providers to respect and maintain professional boundaries while still connecting with our patients. In our practice, we may be witness to a colleague's behavior crossing these boundaries, and this standard sets how we would handle that situation. In the unfortunate event that we do see the warning signs of a colleague crossing a boundary, we can refer to this practice standard so we know how to take part in rectifying the situation.
So item number 4. Assessment is everything to nursing. It is what separates us from any other individual on the street. Assessment allows us to determine a baseline status of our patient, to notice any key changes since the last assessment, and allows for an analysis of findings and possible treatment options. We have included the pocket companion of Jarvis's physical examination, which is right here, and as well as a rapid bedside head-to-toe assessment cheat sheet that we got from our CPS this year. The pocketbook is portable, and it includes information on all assessments in a very effective yet...
Sorry, I just want to say that it's a lot smaller than this in person. Like, this is a printout. It's about yay big in real life and will actually fit in a pocket.
Yeah, so it's portable and includes information on all assessments in a very effective yet a condensed way. And the cheat sheet is a great method for recording information, as it is easy for us to forget the detailed information, and it fosters organization and will aid us when we need to report off to another nurse at the end of the shift, because everything will just be right there.
And our 5th item of our toolbox is the Braden Scale assessment for predicting pressure sore risk in patients. This tool is important specifically for our older adult population or immobile patients to prevent pressure ulcer injury. We know how serious these can be. This is important for all nurses to be aware of due to our constantly aging population and the baby boomers coming into that age now. We must remember that repositioning is the #1 way to prevent the formation of ulcers. So this is on every patient, and when you chart on it, it can be sometimes just simplistic in one little word. So this just allows you to check and make sure you're checking the right things and you can relate it to your patient.
The next item is a table that outlines the causes, signs and symptoms, and consequences of electrolyte imbalances. Semesters 3 and 4 both addressed the importance of recognizing electrolyte imbalances due to the major risk to the patient if they are outside of that normal range. This chart is a quick visual allowing us to see with ease whether or not we may be seeing an electrolyte imbalance. This chart also includes hypo and hypersodium, potassium, phosphate, chloride, calcium, and magnesium. So we can recognize which one it is, and the signs and symptoms, and what are the possible causes. So like, why might this patient be exhibiting what they are exhibiting?
Okay. We have completed lab value cue cards for our 4th semester clinical. These cue cards allow us to determine whether or not the patient is within a normal range for their blood chemistry, hematology, coagulation studies, ABTs, or any other lab values that may have been completed during their stay. This is important for our critical thinking and knowledge applications within our praxis. These lab values can be crucial when looking at medications. Some nursing interventions may be held, and some medications may not be given if lab values are not within a recommended window.
The CNO practice standard for medication plays a role in our authority, competency, and safety as a nurse. This standard provides us an official document to follow should we want to determine whether or not a medication order is clear, complete, and appropriate, and whether or not we should administer a medication, as it allows us to understand if we have the knowledge, skill, and judgment to dispense a drug. Once again, we have highlighted the important components of the standard to provide an effective tool.
All right, so medications could pose life-threatening effects if they're administered incorrectly. We recognize this risk and have found 2 tools that could aid in the prevention of medication error or near misses. The first shows the drug onset, peak, duration of different types of insulin, as this is important for follow-up care and glucometer checks. And the second is a list of the pinch drugs, or otherwise known as high-alert medications, that should be handled with extra precautions. In addition, we will always refer to our nursing drug book, this lovely guy right here. As whenever we do not know a medication, if we are unsure about the dosage, or if we don't know the mode of action or potential adverse effects in the body afterwards. So for our assessments, we know if the heart rate is supposed to drop, we're assessing for that drop in heart.
Chapter 17 of our Calculate with Confidence textbook is about the basic principles of reconstitution of solutions. It provides a 7-step process to reconstitute safely and competently in order to minimize dosage errors. We, as praxis nurses or new nurse graduates, should be able to prepare a solution from a powdered medication, understand how to label a vial medication after it has been reconstituted, how to calculate dosages of reconstituted medications, to determine the rate in milliliters per hour as needed, and to calculate the amount of solute and solvent needed to prepare a desired strength for enteral feedings, as an example.
So, our next and last CNO document is documentation. Documentation is a practice standard provided by CNO in order for us to fully understand why documentation is necessary and how to do it appropriately. This standard outlines why we document communication, accountability, and security. This document will help us monitor our clients' progress and communicate with other healthcare providers in the circle of care. It also facilitates accountability with us as nurses and provides legal protection should we ever need it.
All right, so this tool combines a nursing conversion chart and a common nursing mnemonics chart. We found these charts to be simple yet very useful. They include a list of many different medical abbreviations in the case we forget one of the many we have learned or come across one we have never seen before. And the second chart provides a bunch of different mnemonics to help remember or cue theory that we have learned in our past semesters.
And a few of these, for example, are for mental health. One for anorexia signs and symptoms, the mnemonic is anorexia. One for, let's see, one easy one here, hyperglycemia or hypoglycemia. Hyper, hot, dry, sugar high. Hypo, cold, clammy, needs candy. Which one?
This is this one. So the cranial nerves. To remember them, there's a mnemonic, and it's O-O-O to touch and feel very good velvet. Aha. So that's also a really cool one.
Also, this one's kind of inappropriate, but it would work really well. The cardiac blood flow. It's toilet paper my and so that's tricuspid, pulmonic, mitral, aortic. So just a little way of remembering that. So these are helpful just to have on us and learn about and keep in mind. And those are tips and tricks.
Yeah, we will for sure have all of these things when we go into our praxis setting and then into our future nursing practice. And we hope that you enjoyed it.
Thanks, Julian.
Thanks, Julian.
And you can see my dog here.
Love ya.
Stella. Stand up.
Come here, baby. Come here, Stella.
Look at
Hi, good girl.
Say hi. Say hi. So
it's
sit.
Michelle, Taylor, and
Sit.
Stella.
We should introduce her.
With our toolbox assignment to aid us in the survival of our praxis and in the first few months of our future nursing practice. We've chosen. Can you just like cut stuff out?
Let's just restart because it's already.
So you looking at me.
Yeah, because I'm listening to you talk.
Oh, okay, I see it. So that's normal. Ready? 3, 2.
At praxis, this controlled act
Arts was the infect.
I don't know.
So as two of these little,
Name tag type things?
yeah, name tag card type things, and
Acts and who is off.
outlines all of the competencies mandatory.
Next item is the therapeutic emotional intimacy, empathy, and power. These components are very important. Restart. Okay.
Reboot.
Okay.
Reboot. A baseline status of our patient, to notice any key changes since the last assessment, and allows for an analysis of findings and possible treatment options. We have included the pocket companion of Jarvis's physical examination, which is right here, and as well as a rapid bedside head-to-toe assessment cheat sheet that we got from our CPS. Sorry. The chart is a quick visual. Whether or whether or not we may. This chart is a quick visual chart. This chart.
Just be a typo.
Okay. One more time. This chart.
Maybe just start from the top.
Oh, from the top?
Yeah.
Okay. So the next table. The next table, we have a chair attached to it. Okay? The next item is we knock.
Fever. Hard. Pain. Fever. Okay. You're sleeping.
Sleeping? The next.
Okay, I'm gonna put it back.
Okay, go. Okay. The next table. The next table, we have a chair. The next table, we have an item. The next item is a table that.
I'm sorry.
And a 1, a 2, a 3, you go. And a 1, a 2, a 3, you go. And a 1, a 2, a 3, you go.
Well, as many times as we need, but let's try it. Or any other lab values that may have been completed during their stay. This is important for our critical thinking and knowledge applications within our What?
Sorry, it was upside down. I was like showing it off. I was like, is it correct?
In a normal range for their blood chemistry, hematology, coagulation studies, ABGs, or any other lab values that may have been completed during their stay. This is important for our critical thinking and knowledge application within our praxis.
Empty one.
Is it 7 something already? Yeah.
Oh, yay, I know it's late. Shabbat has already started.
The sun isn't even down yet.
No, Shabbat has already started. Baby.
No, I know Shabbat starts as soon as the sun starts setting, right?
Yeah, so therefore the sun is set.
No, I know. But
No.
the sun isn't like set yet.
Oh,
and it's
I know,
7:30. I'm also thinking like winter-wise. It's really good. Summer. It's a good feeling.
Really started a conversation about the weather. So Julian, it's so nice outside.
Spring is here. Spring is here. Spring is here. Okay. Is within a normal range for their blood chemistry.
Judgment.
Of insulin, as this is important for follow or otherwise known as high alert medications. For our assessments, we know if the heart rate is supposed to drop. We're assessing this doesn't tumble. For nursing drug is.
All right, so chapter 17.
A solution from a powdered medication.
Calculate the amount of solute and solvent needed to repair a desired strength.
Supplementation is necessary.
Mnemonics chart. Oh, I speak now?